SHLI Health Leadership Institute, a center at the Morehouse School of Medicine, develops programs in the community to help. On this episode of SHLI Health Leadership Institute Presents, we begin a two-part series where we focus on integrated health and its goals to reduce the stigma associated with mental disorders and illnesses, while improving access to mental health services by progressively integrating mental health and primary care, and to advance community mental health programs by enhancing resiliency and preventing mental illness.
Hello and welcome to SHLI Health Leadership Institute Presents. SHLI Health Leadership Institute is a center located at Morehouse School of Medicine. I am Dr. Martha Okafor, host for today's program. I will be talking with representatives of 3 community health centers that have been working with SHLI Health Leadership Institute to integrate primary care and behavioral health in their healthcare settings. SHLI Health Leadership Institute has formed a community of practice with 6 community health centers that have transformed their practices to provide both mental health and medical care services to their patients in order to reduce stigma associated with mental illness and improve their patients' health outcomes. Joining me today are Dr. SHLI of ASAG-ENC, Dr. Himera Syed of North Fulton Health Center, and Catherine Mashman of St. Joseph Mercy Care. We will be discussing their innovative leadership efforts to increase access to comprehensive healthcare services for their patients, and we thank them for being here.
Thank you for having us.
Thank you.
Thank you.
So I would like to ask you about how you got involved with SHLI Health Leadership Institute Integrated Care Program.
Well, with St. Joseph's, we learned of the application process, I think, for the year 2012, and we applied. We were very interested in beginning to integrate behavioral health services into our primary care services. And so we thought this would be a great opportunity to be able to launch this new innovative program by getting involved in the Institute. And so we applied through the grant process and were happily accepted, and we've been a part of it since then.
Thank you.
North Fulton and Fulton County attended a conference at Morehouse, and our chief, Dr. Nasri, got interested, and then we applied, and that's how we got involved with the SHLI regarding this integrated care with primary care.
Thank you. Dr. Himera Syed.
Yeah. With ASAG-ENC Health Center, again, we are both North Fulton and ASAG-ENC. We are part of Grady Community Health, and our chief, Dr. Hogai Nasri, was invited to the initiation conference, and I was also invited for that. So this happened in 2011, and then we had, right after that conference, the SHLI offered 2 days training at Cherokee Institute at Knoxville. So we attended that. Now, prior to that, like a year before that, Mental Health America had an intern who was doing an internship at ASAG-ENC, and her job was to screen our patients, all the new patients for depression, and she was using the PHQ-9 scale. And so the data that came out from that showed that we had a very high number, a high percentage of patients with depression as compared to a regular primary care office. And it was difficult for those patients to get care. Access was a big issue, and we realized that. I actually presented that in a poster presentation at Georgia Academy of Family Practice. So based on that information, that really got us interested, and Dr. Nasri was very supportive of this, because it would help our patients and increase access. So that's how, we joined SHLI Health Institute in this, incredible journey.
Well, thank you, Dr. Syed. We know that mental health is one of the leading disability in terms of chronic health disease. Actually, World Health Organization had actually estimated that by 2020, disability associated with mental illness will be the top disability in the whole world, not just in United States. And in United States, we are aware that 1 in every 4 adults has mental illness or mental health problems, actually, that they will experience in a year. So thank you, Dr. Syed, for explaining the prevalence of patients that come to the primary health care clinics, presenting not only medical health problems, but as well as mental health conditions and the challenge of providing them with comprehensive care. So I would like to, I know that that is one of the reasons that we formed a community of practice, and the community of practice has brought together community health centers in Georgia. 3 of your health centers are part of that community of practice. And I would like to ask you, what made you to become a member of SHLI Health Leadership Institute Community of Practice, this being our 3rd year, and what has been your role as a member of Community of Practice?
Well, for St. Joseph Mercy Care Services, the grant was the impetus to getting us involved, but since we've become involved, it's been a really wonderful opportunity to collaborate with other partners from Grady and Fulton County and all the other organizations that are doing similar work and then encountering similar barriers and hurdles, and then also enjoying similar successes. So it's been a really good opportunity to get together either by phone or in person when we do the academies to share stories and talk about what's working, what's not working, and how we can better hone in on what we're doing to enhance the services that we're providing to the community. So that's been, I think, the biggest reason why we have wanted to stay a part of the practice. And then also it's helped us to glean new opportunities to add on to the services that we're doing. So for example, Cobb Douglas did a project last year that we are now modeling for this year's project with our meditation room. So it's given us the opportunity to learn a lot more about what we're doing and how we can add on to the services that we're providing.
Well, thank you, Catherine, for sharing it. I would like to ask you, could you tell us a little bit more about the meditation room and what St. Joseph has been doing as a member of this community of practice?
Sure. So this year we are, the grant proposal that we presented and that was accepted was to create a meditation room, in essence to allow the patients to put into practice the relaxation techniques that they really have already been learning in the groups that they're participating in. So we have a day services program already at one of our clinics that offers skill building for clients, and they're participating in relaxation techniques, meditation. One of our instructors teaches Tai Chi. And so we thought, well, based on what we had learned from Cobb's project last year, it would be really amazing to try to do something similar. So we have remodeled one of our clinic rooms in the clinic and transformed it into a meditation room. We've just furnished it with some couches and comfortable chairs and a rug, and we painted it a very soothing color. And so we're allowing the clients to go in on their off time and at lunch to actually use it in a self-guided fashion. And then from there, we're measuring whether or not they're seeing improvement in hypertension, rates of hypertension, and anxiety and stress.
Wow, that sounds very interesting. And what is it the same program that you did last year, or you were talking about what you're doing this year? What about last year?
Right, so we've added on from what we're doing last year. So last year we implemented a hypertension and depression psychoeducational group. We had 5 cohorts throughout the year for 8-week sessions. And we looked at building skills and education for our patients around managing hypertension and depression. So, like was already mentioned, since we've implemented integrated care, we've been discovering that more and more patients are actually suffering with depression and anxiety and stress. And so we thought this would be a good project to implement because then most of them also have these comorbid conditions. So that's what we did last year, and we were able to see statistically significant improvements in hypertension, reduction in hypertension, and reduction in depression.
All right. Well, thank you so much for sharing your story. And at this moment, we will be wrapping up our first stage, and we'll go on a break. And we will be back on SHLI Health Leadership Institute Presents. And I am Martha Okafor. So stay tuned and join us later. Thank you.
More when we continue on SHLI Health Leadership Institute Presents. The mission of the SHLI Health Leadership Institute is to develop a diverse group of exceptional health leaders, advance and support comprehensive health system strategies, and actively promote policies and practices that will reduce and ultimately eliminate disparities in health. The SHLI Health Leadership Institute's Division of Behavioral Health at Morehouse School of Medicine presents the Integrated Care Conference, Transforming Practices Through Integration of Behavioral Health and Primary Care, on May 23rd. For more information, please contact the Office of Extended Professional Education at 404-756-8908.
Welcome back to SHLI Health Leadership Institute Presents Integration of Behavioral Health and Primary Care Setting. Joining us again is Catherine and Dr. Himera Sayed of North Fulton. Catherine is from St. Joseph, and then we have Dr. Ashat Sayed from ASHLI. Welcome. We will continue with our question. Dr. Himera Sayed, could you share with us what made you to join the community of practice at SHLI Health Leadership Institute on Integrated Care, and what your role has been?
As a staff physician, I always thought that it would be a great opportunity to help patients with mental health needs to have immediate access to care with a psychiatrist. So the community of practice gave us a platform where we all meet by phone conferences weekly, discuss what are our challenges regarding this initiative. We discuss what are our successes, and we learn from each other. We also meet in person, all the sites together, and then we learn regarding the integration of care, and that has given me a good experience with this integration project.
Well, thank you so much. And Dr. Ashat Sayed, what about ASHLI? Could you share with us what made you to join the community of practice?
Sure. Well, I was impressed with the initial thought that this could happen. And there was no other model, that I could learn from, and this offered us an opportunity to learn, to develop a curriculum actually, So we felt that we are the pioneers of this kind of a project. So SHLI Health Leadership Institute offered us that opportunity to learn, to develop a curriculum. And then when we have the conferences that, she spoke about, either by phone and when we have our academy or the, in-person conversations and conferences, that gives us an opportunity to share our experiences, learn from whatever worked, the wins, and also to, if we have issues, about how to progress, I guess that gives us an opportunity to pick up on that and make our project better. So that's the reason we are stuck. We kind of stuck with that. Also, we were very fortunate to have psychiatrists that came out of this grant that SHLI Health Leadership Institute gave us. So we have an embedded adult psychiatrist, Dr. Ren, who is just wonderful, and a child psychiatrist, Dr. Herbert. They are faculty physicians at Morehouse School of Medicine. So we got these people through this. So yes, it was a win-win for us, for our our physicians, who learn so much, who can help our patients, and for our patient population, especially in the area where we practice, in the inner city area of Atlanta.
Thank you. And Dr. Humaira Sayed, for North Fulton, what would you say are the best things that happen through your involvement, maybe for the clinic or for the patients that you have experienced through the community of practice?
We had a lot of positives coming out through this integration initiative. We also have an embedded psychiatrist, Dr. Cook, who helps with patient care. She does didactics. We discuss about the patients. We have easy access to the patients through her. And then we are a recipient of 2 grants. We have identified patients with the depression in our practice, along with 3 comorbid conditions like diabetes, hypertension, and obesity, and we are doing healthy group living for those patients. And we want to see if mental health and physical health are so interrelated that if we improve their depression, their comorbid conditions can get better. And that's one of the initiatives, and I'm so excited to be a part of that. The other initiative through the grant through SHLI is we are trying to develop a motivational interviewing tool in which, as a primary care, we could interview patients in a very concise manner. So these are the 2 initiatives we are involved in at North Fulton.
Well, thank you so much for sharing that. And Catherine, I know you've shared about what St. Joseph is doing. Is there anything that you would like to add to your story about the journey and improvements made at St. Joseph?
Well, I think that one of the best parts about participating in the Academy has been forcing us to really take more of a scientific and research-based approach to the care that we're providing, and I say forced in a good way. So it's giving us that academic balance to the work that we're doing, and I think that has been extremely valuable. So we have all of the resources that your team brings to the table in helping us to look at our data, and make sense of it, and then use the data to help us ultimately to impact our patients, which is the ultimate goal. So, helping to reduce depression and hypertension is wonderful, and then being able to do it in a statistically significant way so that we can then start thinking about the bottom line of getting additional funding and getting additional grant dollars, which is something that you're always talking about, is really, really helpful. So I think that's been the most impactful part of the Academy, whereas other grantors that we work with, they want to see outcome measures, but we send them a report a couple times a year. And here we really have that engagement. And then too, I think, going back to what I said before, having that collaboration with the other agencies is so wonderful, because otherwise I don't know that we would all take the time to do it on our own. Mm-hmm. So having that forum to be able to bounce ideas off one another is really great.
Very good. So at St. Joseph, I know you started with 1 clinic. Are you integrating only in that 1 clinic, or have you made more progress since, I think this is your 3rd year partnering with us as a member of the community of practice? So has there been any kind of leadership change in the clinics at St. Joseph?
Yeah, we have had seen a great deal of expansion. So we have 3 clinics now that have integrated behavioral health services into our primary care setting, and we have 3 licensed clinicians in each of those clinics. And then we have also hired on a full-time psychiatrist also who came through Morehouse as well. And she is really a champion for this kind of work and has been instrumental in helping to train and get a lot of the other primary care providers on board and excited about the work that we're doing. She's very committed to the population that we serve, and given that majority of our patients are homeless and or very poor, impoverished, and marginalized, it's a very challenging population. So having somebody that's very committed to that is really essential. And a part of our strategic plan is to ultimately have behavioral health services embedded in all of our 12 clinics. Wow. So we're getting there, and we're working on expanding all the time. So.
All right. Well, thank you. And Dr. Ashed Syed, what about at ASAGNC? You just mentioned about being one of the pioneers and developing the curriculum. What else happened in ASAGNC in terms of integrated care initiative that you've done that you would say will be a great win for the clinic?
Well, there are multiple. One of the initial thoughts was that we, in general, primary care physicians prescribe the most antidepressant medications, but they don't titrate them to the level where it really helps the patients. And same was the case, So this integration with an embedded psychiatrist, helped us train our physicians. So we have these didactic sessions. We used to have weekly sessions, and our physicians, we have a great group of primary care providers, and we would give, they would give their lunch hour on Mondays and meet with the psychiatrist, where we would do case discussions, 4 to 5 cases each time. We would have didactic sessions, right? And then with the help of another psychiatrist from your group, algorithm was made, which specifically had steps as to how to start medications, how to titrate medications, when to look for other things, and how to use medicine to a pretty high level. So this process really helped us with that algorithm. So our providers feel very comfortable, going up to a pretty decent level. So we can easily treat, depression and anxiety, at least the mild level. Also, this gave us an avenue to decide which patients we should keep and which we should refer out. So we could look for resources, we could spot resources and have the patient taken care of at the other places that we could not. So it was a big win, for our patients. And so I think, that was huge.
Okay, well, thank you. What about we've talked about what happened, the best thing that happened. What about challenges that you experienced in this initiative? Any challenges you felt that was kind of a setback or you learned from, and how you handled it? That would be great for our viewers to hear that as well.
I think time is the main restraint for us, as we have a very busy practice, and also we need involvement of other physicians in the practice and the leadership. So for me, time was a big challenging factor, but with your help and SHLI group, and because of the community of practice, every week we knew that we have to be more focused, and that kept us going.
Oh, thank you.
And with ASAGNC, I would say, this is something that we were committed to do. And so we looked at it very positively. I think we had so many wins that the challenges seemed timid, after that time. We were, we got recognized through the National Council of Healthcare. We actually got recognition, which is the second position, and they gave us a cash award. We were recipient of the mini grant from SHLI. We also got a decent cash grant from SBIRT. So with the help of that, we could buy a kiosk for our patients. So this is a wonderful kiosk. It's state of art, and all our new patients can get a health screen. And those patients who have history of mental disease, they can go and do their questionnaire. And at the end of that questionnaire, it's a very easy questionnaire where patient just use the kiosk. It's a touch screen, and it prints out the results, which you take which the patient takes to the provider, and the PHI is protected and everything. So this gave us an opportunity to further screen. So that job that Mental Health of America was doing, that intern, we have this kiosk which is doing it, and our psychiatrist really works on it and analyzes the data. And then we have Dr. Victor and Rosemary from SHLI who help us furthermore with that. So we have had all these wins. Challenges at the moment, what we are having is, we don't have personnel to direct the patients to the kiosk. So we recently moved the kiosk inside the clinic area to have more use of it. But it's going well.
Well, thank you. And Catherine, any challenges or that you would like to share with the viewers?
Sure. I think the biggest challenge has been the transient nature of our patient population and getting patients to either complete, as it was last year, the entire 8-week series of groups, and then not being able to collect the necessary data we need to then evaluate the program. And I think that's going to be an ongoing struggle given our patient population. Frequently, many of our clinics are co-located with a partner organization that might have transitional housing attached to it or a shelter component. And so many of those patients are only in that environment temporarily and then they're moving on. So really figuring out a way to get the best bang for our buck while we're with that patient, knowing that they may not be with us for the long term. Just building those relationships and doing what we can while we have the patient with us.
Okay. Any last word any of you want to share with our viewers?
I think for folks that want to integrate, I think we need to spread the word that this is possible. It is not as difficult or as unseemingly as it could sound. Well, first and foremost, try to assess yourself, see if there's a need. Have your leadership buy-in, and make sure that you have resources. And in the curriculum that SHLI has developed, that could be a guiding light, and then go for it. I think that there are lots of gains to this.
All right. Well, thank you so much, Dr. Ashad Syed from ASAGNC and Dr. Himaris Syed from North Fulton Health Clinic and Catherine Marshman from St. Joseph Health Center. And for our viewers, thank you so much. We are looking forward to our next segment from SHLI Health Leadership Institute Presents. I am Dr. Martha Okafor. Thank you for joining us, and you will find information on how to contact us at SHLI Health Leadership Institute after the show on the screen.
On the next episode of the SHLI Health Leadership Institute presents...
Our intervention through the community of practice is an extension or an add-on really to our current work through the SAMHSA grant, where we're creating the healthcare home.
Funding for this program was provided by a grant from the Southwest Hospital and Medical Complex Foundation. To learn more about how to implement integrated care, please visit shli.msm.edu.